Welcome to your chin lipo pre-op instructions. I'm Dr. Paul Pearce, and these instructions will help you prepare to make your procedure go as smoothly as possible so that we can all work together to get you the best results possible. Be sure to watch this video all the way through if it's the first time watching it so you don't miss anything, but after that you can use the chapter markers below to find the information you might need the closer we get to the day of surgery. Also, these instructions are for my patients only, so if you are having surgery with another surgeon, please follow their instructions, not mine. With that said, let's get into it. 14 days or more before surgery. So 2 weeks or more before the procedure, you're gonna need to start making arrangements to take some time off from work and from the gym. If you work from home or do mostly computer work, you can go back to work within about 2 to 3 days after the procedure, as long as you're not taking any pain narcotics. Most of our patients are off their pain narcotics and using extra strength Tylenol within about 2 to 3 days after the procedure. However, if your job has a more hands-on aspect to it involving heavy lifting and strenuous activity, you're going to need to make arrangements to take a week off so all that strenuous activity doesn't increase your risk of post-operative complications. Another reason to arrange some time off is if it's going to be an issue wearing your facial compression garment 24/7 for about 5 to 7 days after the procedure. The same goes for the gym and running. You'll also need to take it easy for about 10 days post-op. You'll need to give your new neckline enough time to heal and decrease your risk of having any major post-operative complications. I would love it if you could get 2 weeks without strenuous activity or the gym, but 10 days would be the minimum. If you are traveling to Austin from out of town, please make sure to arrange your hotel accommodations for the night before the procedure and to stay for about 5 days minimum after the procedure so that we can check on your progress in the first week. You also need to arrange for someone to drive you to and from the surgery. We are going to be giving you an oral sedative before the procedure to help you relax, and that will make it where you cannot drive afterwards. Even if you choose not to have an oral sedative for the procedure, you still cannot drive yourself home, so please make sure to arrange a ride home. Uber or any other type of ride share service is also not allowed to take you home post-op. So now we're down to 7 days before the surgery. If you are on any prescribed blood thinners such as Plavix, Coumadin, Xarelto, or Eliquis, then myself and your prescribing physician will have previously discussed if this procedure will be low risk enough for you to proceed with in general. We will have also worked out a plan for you to stop those meds in time in order to make it safe for the procedure as well as transition to any other type of blood thinner such as heparin or Lovenox that can be stopped closer to the surgery. If this applies to you, then you and I will have discussed the plan in detail as to when to stop all of your blood thinners and then continue on with the heparin or Lovenox. An over-the-counter medication that can also increase your risk of bleeding is ibuprofen, so please avoid taking this medication for a week before your procedure as well. If you need to take something for pain, use Tylenol instead. Let's talk about supplements. So 7 days prior to your procedure, you'll also need to stop the following supplements, as these can increase the risk of bleeding both during and after your procedure. Supplements such as garlic, ginger, ginseng, ginkgo, and vitamin E can all increase your risk of bleeding. Other supplements to avoid are those that can increase your blood pressure, such as energy supplements, ephedra, and licorice. Does anyone even eat licorice anymore? I feel like that's such like an 1800s type of candy. I don't know. If you are taking a supplement that's not listed here, let's make sure we talk about it before your procedure to make sure it won't interfere with the procedure or possibly affect your results afterwards. The other thing you will need to stop 7 days prior to your procedure is alcohol consumption of any kind. All alcohol tends to thin your blood out, so once again, this can increase your risk of bleeding during and after the procedure. So now it's 3 days before surgery. The big day is almost here, and it's time to start gearing up for the big day as well as for what is to come after your procedure. Here are 4 things I recommend you do with 3 days left before your surgery. Number 1, confirm you still have a ride to and from the procedure. Sometimes people forget, so it's good to just talk about it again. 2, stock up on whatever you may need if you plan on not leaving the house for a week while you recover. Get that pantry all stocked up. Make sure you remember your streaming service password, do some laundry, clean the house. Essentially make it so you don't have to worry about anything during your recovery. 3, pick out a few towels that you don't care if they get messy after the procedure. You're gonna have some drainage from the little incisions behind your ear, and it may run off the pads that we give you. So it's better to have it run off onto your towels rather than onto your bed sheets. So make sure it's a towel you don't mind getting a little messy. 4, make sure you have your prescriptions that were sent to your pharmacy. If you do not have them by this time, please call our office so that we can take care of this as soon as possible. All right, it's the night before the procedure. So what are you gonna do? You are going to take it easy. You've got a big day ahead of you tomorrow, so it's time to relax and get some rest. Make sure to set your alarm so you can be on time. You don't want to be in a rush getting out the door, so make sure you get up with plenty of time to spare. Pick out some comfortable clothes and shoes that you'll wear for the day of the procedure. The things that will make your day go easier are shoes that are easy to get in and out of, like slides or sandals. We don't want you bending over after the procedure, as this can increase the risk of postoperative bleeding. Also, wearing a button-up shirt or a zip-up hoodie will make it easier for you to change into your procedure gown, both before the procedure and after. All right, it is the morning of the procedure, so rise and shine. Don't hit that snooze button. It's time to head into the office or to the operating room so we can create your new jawline. Once you're up, take a shower, make sure to wash your hair, but please don't put any products in your hair. Also, ladies, please do not put on any makeup the day of the procedure. We need your bare skin for markings, so it'll just be a waste of makeup if you put it on and then we have to wipe it all off anyway. Also, please make sure to leave your valuables and jewelry at home too. You won't need them while you're here. If we are doing your procedure here in the office under local anesthetic, then you can go ahead and eat a light breakfast and make sure to drink plenty of water, especially for you ladies, as we will be doing a pregnancy test before starting the procedure just to be on the safe side. So drink up on the way to the office as well, because we want you to get here ready to give a sample as soon as you get here. If you're having your chin lipo done under general anesthesia in the operating room, you will not be eating or drinking anything until after your surgery. So please do not have anything to eat or drink after midnight the night before your surgery. Once you arrive at the office, you'll be escorted to your exam room and then to do your pregnancy test if that's needed. I'll be seeing you soon after that, and then it will be time to start working on your new jawline. We'll see you soon, and please call us if you have any questions about these pre-op instructions or about anything else that wasn't covered here. And if you want to get started preparing for your recovery, then you can watch this video right here, where we talk all about post-op instructions for chin lipo. I'm Dr. Paul Pearce, and I hope you learned something today. We'll see you in the next one.